reasons that people who have chronic pain end up feeling misunderstood by the healthcare system?
I think the first and foremost reason is that the healthcare system, for the most part, does misunderstand chronic pain, which then leads to like a misunderstanding of their patients. And I think that can be from so many different factors. So I think one factor that I really want to acknowledge is that even if a practitioner has a really good understanding of chronic pain, depending on the system that they're in, it just does not allow for the time that is needed to address that. You cannot address chronic pain in like a 7-minute practitioner visit. So like, even if it's the most versed practitioners, like they cannot really help their patient feel understood. There's no way someone can get really share their whole story. And unfortunately, that is a lot of how our medical system works. And it's not, some malicious intent by the doctor.
I've had, just to go on, like I've had patients who are like, I was trying to tell them, but I never got to tell them that, like when I was 15, I fell off a horse. And when I told them, they seemed annoyed. But you can see, you can see the practitioner's point of view where it's just like, oh, they have 5 minutes.
Yeah.
You know what I mean? And not that that's right, but that's like the system.
Totally. And I think sometimes the frustration and annoyance is that they know they cannot help you in that moment is part of it. It's like, oh my gosh, it's like they can see that you need more help than they can give and are literally able to give. And so I think that's one. I just always like to acknowledge that, because I think sometimes doctors get unfairly negatively treated because of that. But then the other thing is that chronic pain is so complex. And there's so many factors that go into it that, again, need the time and space to untangle and uncover. And so rarely is that done in one session.
Right.
And so oftentimes what happens is it has gotten watered down as we've become more aware of how, this mind-body connection and how the nervous system plays a role and how our brain can mediate pain and modulate pain and things like that. It's gotten stuck down to this one talking point of your brain creates pain.
Oh yes.
And then it's started to become this thing of well, it's all in your head, move on. And it's oh no. And so that can lead to a lot of feelings of, being misunderstood, obviously, because it's not like anyone wants to be experiencing chronic pain.
Oh yeah, absolutely. They signed up for it.
And
or they might ignore symptoms. I had a patient last week. They're like, "I'm just convinced it's all in my head." I'm like, "Okay, but
totally.
Okay, but let's talk about it. What if there are some things we need to explore here?"
Yeah.
But so it can definitely get overly downplayed too.
When I see that happening more and more, and I think it's fascinating because it's this whole all in your head concept. It's as if our brain doesn't play this massive role in our body. Why are we downplaying our brain's role in our entire body?
I love that way of thinking about it.
And then I always like to joke around with people is if someone tells you it's all in their head, you can kick them in the shin and tell them to stop whining about it, because that pain is technically also all in their head, right?
Yes.
It still hurts. That doesn't help.
Yeah,
right.
And so I think those are the biggest misconceptions. And then I also think sometimes, again, because of the complexity, ultimately, I don't know that there is any case of chronic pain that ever comes down to just one thing that we're looking at. And often I think there are some practitioners that might be really well-rounded in certain areas, just like me. I know I have certain biases and I'm more expert in some areas of chronic pain and treatment. And so I think some practitioners don't always recognize that what they specialize isn't the piece that patient really needs or the client really needs.
It's if you have a hammer, everything looks like a nail.
Yes, and so sometimes I think that another reason patients can feel really misunderstood or discouraged is they go to this person who's this person cured me, and they have all these amazing testimonials, and they cured my pain, and it was this magical fix, and then they go and they didn't receive a benefit, and then they're what is wrong with me? And then that happens over and over and over again, and it just builds these layers and layers of kind of deepening them into the hole of what is wrong with me. And often it's just sometimes that the right treatment hasn't been matched up to what they needed and what their body needed.
And I think a lot of times what happens in those situations is people try to put it back on the person of you're not doing enough. And that's something you taught, you definitely talk about, and I've learned a lot from you, is that like to expect someone to get like to essentially practice a monk's version of mindfulness is not fair. It's not fair for their lifestyle. It's just like, oh, did you do your 2.5 hours of meditation that's going to help you out of pain? It's like that's not fair to ask anyone to be able to put that much of their life into. And we see it in that kind of world. We also, I mean, how many times have you seen people come in like after going to another PT place maybe, and they have like a stack of of exercises, like, well, my PT said that if I do every single exercise, I'm like, I don't have 2 hours. And so I think that's something that you talk really well, like highly about, is like thinking about what are you truly asking that person to do.
Yeah, we really also ultimately have to meet everyone where they are, which requires, again, I think this is a huge part of the misunderstanding. To meet someone where they are requires someone to understand where they are, which again takes time. So if you are being told, yes, to meditate an hour a day, and the practitioner hasn't taken into account that you're a single mom with 4 kids, one of your kids has their own school and behavioral issues, and you're also a caregiver for your parent, it's like, that's not meeting them where they are. Like, how are they, supposed to do that? So it's like, we first have to understand where someone is to meet them there. Otherwise, you leave feeling very misunderstood. Like, okay, maybe that might work, but how am I supposed to implement that in my life?
Absolutely. So kind of going off, like on to the next question, what do you feel like people with chronic pain really benefit from with the more holistic approach? I think you just started talking about it. So
yeah, I mean, it's definitely a meeting them where they are. And it's a really breaking things down into really little steps that feel very actionable to them and still are taking into account the complexities, and also being, I think, really open and honest with a person.
I love that.
Of like, okay, yes, we're seeing, there may be some nutritional aspects, there may be some, aspects with bringing down the nervous system sensitivity, which may be stress and lifestyle related, but rather than telling someone, like, I think even bringing in the holistic thing to the stress management piece is huge. It's like, well, what's creating the stress? How much control does this person actually have? And actually backing them up to the point where they can actually work on it. So often people might be told to, like, hey, meditate 15 minutes. And maybe the 15 minutes feels very manageable, but when they sit down to be with their body, what's not being acknowledged is that feels terrifying. They sit down and it sends their nervous system.
I think we've all seen patients who do that, like, oh, I can't do that.
Into a more stressed out state, because it's what hasn't been acknowledged is that feels like the threat to be in the body. So it's like, we have to back up further of how do we create the safety to even be in the body. And then there might be certain emotions that are, again, creating the threat. So we have to keep backing up to, like, where can the person kind of see this next step and be like, oh, that feels really good to do.
Yes, absolutely.
And that can be, again, any one of the pieces, whether it's sleep related, nutrition related, stress management, nervous system related, exercise, movement related. Again, I try never to put my bias on, maybe I could be like, oh, this would help this person so much, but they're like, actually, I can start here. And then it's like, amazing. You know what I mean? Because ultimately that is where they're going to get the most benefit. But I think that's like, yes, okay, that's I can do.
Right. Essentially bringing information to the person instead of expecting people to come to the information. Yeah. It's just like sometimes that's too much. Yeah.
And often, like, within my sessions, and again, with a holistic approach, I'm always trying to have the person's nervous system guide the next step. And so it's like, we always are finding that safety to be with the body, to help them. It's amazing how much, we can have different conversations, look at different aspects, help bring in all these educational pieces. And then at the end, it's like, okay, and then, like, what is the next right step? And sometimes it might be something really directly about what we talked about. And sometimes they'll come up with something that's like, we didn't talk about that at all, but awesome, like, amazing.
But you
it's like
opened them
their
up
body
enough.
just is like, and here's this exact piece. And it's like,
cool.
oh, that's so cool. Like, it's amazing what, like, the body can come up with when you give it the space and the safety to do that.
Cool. So what would you feel, or are there a couple of examples that you have of actual patients that you feel have come on the other side of this and didn't even think that they could have been helped, so that they had that chronic pain and you started working with them and you were able to achieve something that they didn't even realize that it was available to them.
Yeah, I have one really, I feel like, dramatic example that I like to share because it's really cool. And so this guy, was like a 40-year-old guy. He was like a laborer, like worked in construction.
Yeah.
And he had been seeing a coworker of mine at the time, and this was at a different clinic. And they had gotten somewhere, but were stuck. So she's like, hey, you know what, I think, there's some things that are like mindset pieces, some misunderstanding that I really think you could use some like chronic pain education. So she brought me in, and at that point I had the luxury of knowing her treatment and her evaluation assessment was that, like, physically he was good. Like there wasn't really any, there was some strengthening stuff that needed to happen, but everything was sound from that aspect. And so when I started talking to him, he basically told me that after his work injury, the doctor told him that he better find another job.
Oh, wow.
Because he's going to spend the rest of his life lying on a computer, lying on his stomach, only being able to do computer work.
Oh my gosh.
Yeah. And
which I'm sure he had no training in, so that's even scarier.
Exactly.
Like, what kind of computer work was he doing?
Yeah, he was like a laborer, right? Like that, and he loved being active, loved being outside. It was like a year and a half beforehand, okay? So at this point, so he became so scared to move, so scared to do anything to damage his back further, things like that. And I basically, again, because I had like my coworker who had done an amazing evaluation to clear everything. I had all the imaging, it's like at that point I knew he was good. Provided him with education, and literally in that day, he wouldn't at that point probably lift up anything past like a milk gallon. Had him doing cleans with like a 50-pound sandbag. And he was like, the happiest person ever. Like, it was amazing. And from then on, he went back and saw my coworker, but it was like, I would see him in the gym and he was doing all kinds of stuff. And like within a couple sessions, he was good to go and discharged. And I'm sure eventually went back to construction. So that was like a really dramatic example of just understanding our body and wiring some neural circuits and mind frames that can really make a difference. And then I'll give one more if that's okay.
Yeah, absolutely.
I had somebody else who, when we started seeing each other, she had been in chronic pain for over a decade, and really her life had just kept getting smaller and smaller and smaller. And it was the same sort of thing where she felt like, okay, if anything I do, I'm risking making things worse. And ultimately, again, physically, there really wasn't anything to back that up. And for her, there was a lot of emotional trauma, childhood trauma. Like there was a whole, again, after getting the whole, history, which, takes some time to do, it became very clear that this was much more of an emotional, somatic component. So after doing, working together for quite some time and building safety to be with her body and her nervous system, she eventually, some of her goals were to get back to riding a horse, because she actually had a horse farm, and to be in a choir, and then to be able to, when she has grandkids, because her son had recently been married, that she can pick them up.
See, those are the goals. Like, people sometimes think it's always like some sort of like hardcore physical goal, but like, being in the choir takes the physicality, and then of course working, like being able to be with your grandkid.
Totally. And so where she is now, because we are still working together, she's been riding horses. She's been in the choir now for I think the past 6 months. That's awesome. And she still does have some pain. It's like her pain isn't completely gone, but she's happy. Yes. She's getting to do all these things, and she just told me last week that she's going to be a grandma in a couple months.
Oh, that's awesome.
Daughter-in-law, that's the word. I was looking for her daughter-in-law's pregnant. So it's and she's been working with a physical or a personal trainer too for the strength aspect. And she's like, so I'm working, and she's able to do all the strengthening work to be building up for that.
And isn't it cool, just watching the smile on your face when you're talking about her, what we get out of all of this. It's kind of, the joke that you made, we don't celebrate someone's range of motion. I could care less, that someone got, 25 more degrees of hip rotation. I care that they're having a grandchild and not worried about it, but excited about it, because they're not carrying that worry or shame or guilt about maybe not being able to be a major part of that grandchild's life, or, seeing those are the things we celebrate. Totally. So that's super cool.
Yeah.